Hi, Vince Ferguson here. Did you know that even Serena Williams took the shot? But at what cost? When I saw the Super Bowl and watched Serena Williams appear in a Super Bowl commercial promoting a GLP-1 weight loss injection, I paused. Wait a minute. Not because I wanted to criticize Serena Williams, not because I doubted her discipline or work ethic, not at all, but because Serena Williams represents something deeper in our culture. She is one of the greatest athletes of all time, and I make no hesitation about that. She's a woman whose body once symbolized strength, power, endurance, and resilience. And here she was on the biggest advertising stage in the world, the Super Bowl, talking about a drug to help her lose weight. And at that moment, it made me ask a question that I think we all need to ask. If someone with unlimited access to trainers, chefs, doctors, and resources feels compelled to inject herself to manage weight, what does that say to the rest of us watching at home? That's what this conversation is really about. But let's be fair, GLP-1 medications didn't come out of nowhere. They were originally developed and designed for people with type 2 diabetes, insulin resistance, and serious metabolic dysfunction. For some individuals, these drugs can reduce appetite, food noise, improve blood sugar control, and help initiate weight loss when nothing else has worked. That's very true. And for people dealing with legitimate medical conditions like this, that can feel life-changing. I agree. But Serena herself has said losing weight reduced strain on her joints, especially her knee joints, and made her feel lighter in her day-to-day life. And I don't dismiss that. As a matter of fact, I respect it. And I respect Serena Williams. But here's where the conversation usually stops. And it shouldn't. It should continue on. Because commercials show the benefits, right? How well we feel, how we look now that we've taken the drugs, but it doesn't show the consequences of taking those drugs. Well, let's talk about the downsides that don't make it into a 30 or 45-second commercial ad. Let's talk about the cost. Did you know that many of these drugs can cost you between $1,000 and $1,500 to $1,500 per month? That's often out of pocket. Insurance coverage is inconsistent. And when coverage ends, access ends. So here's the real question. What happens when you can't afford to stay on the drugs? I don't know about you, but paying $1,000 to $1,500 per month is a significant amount of money unless you are a famous athlete or celebrity who can afford it. So what happens when you can't afford it? That's my question. You know what happens? You gain back the weight. Did you know that? But that's the part that gets whispered. What you say, it gets whispered. You don't hear it as well, if it's mentioned at all. Many people regain most or all the weight once they stop taking the drugs. But why does this happen? Because the medication didn't teach the body how to function better. It just temporarily suppressed the appetite. It didn't deal with the main issue. When the drug stops, hunger returns, and often with a vengeance. Now, weight management becomes medication management, and that means muscle loss. Muscle loss. Rapid weight loss doesn't just pull fat from the body, it often pulls muscle too. You're losing fat and you're losing protein. Did you know that? And muscle isn't cosmetic. Muscle is what keeps you mobile, balanced, independent, able to get off a chair without trying to holding on to the side of the chair to get up. But if you lose your muscle, you can become weaker. Did you even know that? You're not hearing about this in the fine print. This is a dangerous trade-off, especially for those of us over 40, over 50, over 60 and beyond. And let's not forget, there are some known side effects from taking this drug as well, such as nausea, digestive issues, fatigue, just to name a few. And here's the honest truth. We don't yet know the long-term effects of lifelong GLP-1 or extended GLP-1 use. That's right. And you know, medicine has a long history of discovering the fine print of our side effects after mass adoption. In other words, you don't find out about the real side effects, the long-term severe side effects, until thousands or millions have taken the drugs over a few years. And then it's too late to reverse the problem. You've got to be very careful about what you are injecting into your body. I often say the body was meant to heal itself, give it what it needs, and it'll heal, even when it comes to obesity or weight gain. There are things you can do for your body. Have you heard of intermittent fasting and how powerful that is? The intermittent fasting gets rid of the bad cells and the good cells destroy the bad cells. It also allows what's called autophagy, which is a way for your body to consume the fat that's on it, to get rid of the fat. But that's when you're fasting. You don't have to eat 4 or 5 meals a day like I was taught growing up. I taught myself that growing up. And I realized that's not the way to live a healthy life. Did you even think about that? But again, let's put the blame where it lies. There's a scripture in the Bible that says, "My people suffer from lack of knowledge." You've got to know, you've got to learn, you've got to study and research for yourself to understand these things. But zoom out with me for a minute, because this isn't really about Serena Williams. I respect her. It's about what we're being conditioned to believe. And that conditioning is that health comes with a syringe. If that was the case, then most junkies who use syringes would be healthy. We are also taught to believe that weight loss equals wellness, and that's not necessarily true at all. We're taught that managing the body chemically is easier than rebuilding it functionally. And I can tell you for a fact, that's not true. But real health, the kind that lasts, comes from strength, movement, nourishment, sleep, mindset, and consistency. Consistency beats intensity any time, any day of the week. The human body hasn't changed in, I would guess, thousands of years at least. If a medication is medically necessary, supervised by a physician, and used with full awareness of the risk, that's a personal, informed decision. Your body, your choice. But you're informed. You know what to expect. You weigh the pros and cons. And after all that, you made the decision to do that? Well, God bless you. You're informed. But if the goal is long-term vitality, independence, and confidence, shortcuts come with consequences. You don't borrow health from the future without paying interest. And my role, your role, is to ask better questions before following the trend. Because weight loss without strength is not health. And any solution that only works while you stay on it deserves a closer look. And what do you think? Do you agree with me? Leave your comments below. I would love to hear and to respond to.